Hi, everyone. I am Dr. Anita Wong, board certified emergency physician and fellow in anti-aging metabolic functional medicine. I'm practicing preventative medicine, focus on immune resilience, restoring energy, better intimacy, a strong core, anti-leaking, and anti-sagging. Right? Could be anywhere. Sagging. So to provide a quality of life with optimal health and vitality to the end. So it's a goal that I set for myself and for you. And these little vignettes that I'm doing is just hope to share with you some, if you have any questions or my take on this. And so I wanted to talk about strokes. It's one thing that I actually really check because stroke is going to be because if you're out of the growth and development phase, we're all in that aging process. We're all maturing, and depending on your family history, your lifestyle, um, we have an expiration date, and I hope it's a very long one. And um, but so blood clotting is a concern as you go down that continuum. If your blood pressure gets high, so that's with stiff arteries, it tends to raise your blood pressure. You also have a higher risk of stroke. So there's something that I really monitor and look at. So and it's something that familiar with that we can actually monitor and predict in a family that has history of high blood pressure, and that I've checked levels in the youth of the family and see that they'll have markers that shows that there's a risk. We need to change the lifestyle to prevent it from ever happening. But so what is a stroke, or what happens actually? So blood clotting is actually a good thing for us. Everything is a good thing until it's an extreme. Okay? So if you're bleeding, have an injury, you want your blood to clot. You want the platelets to aggregate, to clump up and stop that bleeding. You want to prevent bacteria getting into the wounds. But what you don't want is abnormal formation of clots into your blood vessels in the veins or in the arteries, and developing pulmonary embolism, clot to the lungs or to the coronary, to the heart. That's all the little blood vessels and have part of the heart tissue die, or in the brain and have part of the brain die. So, or it can be, so it could be a clot formation because the blood doesn't flow smoothly. You have sticky blood or thick, viscous blood doesn't flow smoothly. And when it does turbulence, they can throw off little clots, little embolies. Or you could have developing plaques, debris on the blood vessels themselves. And then these platelets and proteins and cells, they become sticky and they decrease the size of on the blood vessels, and they could form blood clots, right? And the blood vessels can becoming more narrow, and that causing not enough adequate blood flow to certain areas. There's 13 substrates in the blood and the tissues that are going to create these clotting factors or coagulation factors. So when they all work in unison, it's a great thing. But when it goes awry, it's going to create problems. And your body can naturally dissolve clots. So when you bump your arm and you get that black and blue, that bruise is essentially open bleeding. Blood is coagulated, and then it's going to dissolve. So it goes through those phases: purple, green, yellow, things like that. It's all getting healed. But if the blood flows, like I said, if it's flowing too slowly and the platelets are clumping and you're forming these clots, and you don't, dissolve, and they're not dissolving naturally, you're going to seek medical attention. So a lot of times when you have a clot, some of the symptoms that you're having, I think many people know a lot about those. So let's say in your heart. So you have the veins are taking deoxygenated or blood that has not enough oxygen to the heart. And then arteries are taking the blood away from the heart that's got oxygen and nutrients and supplying the organs and everything with the oxygen and what they need. So in the heart, when you have an artery that is blocked and not getting the nutrients to the heart, and the the muscles will die in the heart, and you can get a heaviness or a pain in the chest, or you feel short of breath, or nausea, or sweating, or lightheaded, or dizzy, or just some discomfort. A lot of women have atypical symptoms and just have some maybe gastric intestinal just discomfort, right? So these are times you're going to seek medical attention. You want to get there early. Um, and if it goes to the brain, if you don't get enough oxygen and you have a blood clot that's in the artery in the area of the brain, depending on the areas, you get a weakness of the face, arms, legs, vision problems, difficulty speaking, sudden or severe headache or dizziness. There's always medical attention. And in the lungs, if you get a sharp chest pain, shortness of breath, or racing heart, or fever, or sweating, or coughing up blood, this could be an obstruction of one of the arteries or the blood vessels in there, in the lungs. If you have one clot in the arms or the legs, it could be a sudden onset or a gradual onset. You're going to have swelling, tenderness, there could be increased warmth. Of it, because there's either it's in the vein or it's in the artery. You're going to have different symptoms. And in the abdomen, usually it's going to be, a lot of times it's the artery, and you have an intense abdominal pain with vomiting and diarrhea. So the major blood vessels, the veins, the large ones, that's usually the deep vein thrombosis. Those are the major ones that you get. You get them in the legs. The things that worrisome is that they can break off and travel and go into the lungs. Sometimes people will have to have surgery, have a filter put so that they're not throwing off these clots all the time. And then the arteries are where you're getting the oxygen. So things that you can do to really make sure that you have enough oxygen or that you're avoiding clots is really diet. Again, it comes down to the diet. You don't want an inflammatory diet. You want to eat whole foods, omega-3s, green leafy vegetables. This will help with the flow. Beets are good, pomegranates, walnuts are good too. All of these things will help nourish the body and help with some of the activities of clotting. So doing exercise, being active, HIITs is a really good one, high intensity workout, because this will increase your nitric oxide, which is very important to keep your blood vessels dilated. I'll talk about that in a little bit. If you're taking medications that can create thickened or clots and things, so you might discuss it with your primary care doctor and see if you need to change your medications. Some of the synthetic hormones can be a problem, not typically the bioidentical, because that's part of our natural makeup and chemistry, but the synthetic birth control pills can create clots, and so you can have a pulmonary embolism, a clot to the lung. Smoking is a risk factor, it will increase it. Things that will help is taking turmeric, and decrease inflammation. Garlic is is good, especially aged garlic. Vitamin E and chrysanthemum oil is also good, rubbing it over to break it up. But one of the things that I do in the office, that if I'm monitoring a family or checking, for risk factors, I always check the nitric oxide. I don't think that it's given much credence or enough acknowledgement about the benefits of nitric oxide. The nitric oxide it signals the blood vessels in the body to relax and to dilate, and they help deliver oxygen and nutrients to the body. Just enhance your circulation. So having a good nitric oxide level will help with circulation, your cardiovascular performance, and decreases the viscosity, that sticky blood so it flows smoothly without having like turbulence and then becoming getting clots. So you don't want any turbulence going and creating making the platelets to aggregate and creating clots. So you want a nice smooth flow. So the larger the blood vessels, so you want your internal vessels and your organs to be able to dilate and contract and be flexible, and having that dilation is important, and nitric oxide is key to that. Um, so platelets that, as I mentioned above that earlier, is that when the platelets coagulate and cause clumping or cause a clot, it can go to cardiovascular, to your heart, or to your brain, to your lungs. And the nitric oxide just can regulate some of this. There's also essential overall health needs. It supports blood pressure. So when you have flexible blood vessels, instead of having a high pressure, the blood flowing through and the walls being stiff, they're dynamic. But if they're getting stiff, that's when you're going to have higher blood pressure. And that's also when you're going to have maybe a hemorrhage, because if the blood vessel is stiff and then it has that pressure constantly in an area, it gets weaker and it can cause a disruption in the blood vessel and cause bleeding, hemorrhage in the brain. So that would be different than a blood clot, a stroke, but would be bleeding. So you want to have the nitric oxide to keep the blood vessels dilated and flexible. It helps and will keep your blood pressure down, right? Regulate your blood pressure. So the way we get nitric oxide is not something that's just in our system and it's just depleted. We get it through nitrates, and the nitrates is through our diet, and then it's converted. And it's converted by the bacteria that's in our mouth and in our gut and in the mucosal linings of that. So if you don't have the enzyme to convert the nitrates into nitric oxide, it could be a familial issue, so that you have high blood pressure, so you need a supplement of nitric oxide, or just taking a diet. And you want to make sure that when you're eating clean, organic, a lot of times there's not enough nitrates in it because they're not allowed to put nitrates in the soil, which would then they can't be labeled as organic. So you want to make sure you're eating a good amount of colorful beets, pomegranates. Organ meats are really good with nitric oxide. So you want to get that, a nutrient dense food if you can. So if you know how the earth is and the soil was cared for and it's healthy and nutrient dense, you might get enough nitrates to convert to nitric oxide. The other thing is that if the mouth contains a lot of the bacteria too. It's all the mucosal linings and in through the nose. So when you exercise, you want to breathe through your nose. You can stimulate that, elevate the nitric oxide. And the mouthwash and fluoride kills the bacteria in the mouth that actually, so when you're doing all that chewing of those leafy greens and, all the rainbow colored foods, you want to make sure it's chewed and broken up, and the enzymes then convert the nitrates into nitric oxide. Little known fact that nitric oxide really helps with erectile dysfunction. So erectile dysfunction could be an issue of not strong enough pelvic muscles. So then you're going to want to come and sit on the emsella. Emsella helps you build those muscles back up and get your circulation and vasodilatation. So improving your erectile dysfunction. You can definitely boost that. Some of the foods that I've listed that I've mentioned to you is the red beets, beetroots, leafy greens, arugula, leafy greens, leeks, endive, radishes, spinach, celery, the cabbage, cucumbers, all of these things, carrots, cauliflower, so many more. Pomegranate I mentioned, all help. And then just moving, if you just move your body, and then if I like to do, so this came from, I think Dr. Bush, an internist that developed that using all the large muscle groups. So if you do a rotation of 3 cycles, and 3 minutes and 3 times, moving all the large muscle groups. So it's the squatting is one, moving the arms, doing a movement of like what is that, jumping jacks, and then lifting up and rotating that really helps if you're not really getting into doing exercise for that. So one of my big things is that if I have a family and the parents have hypertension, I check their children, and if they have good nitric oxide levels, then we're good, and their blood pressure stays low and the levels are good. But if they are already having a low nitric oxide and they have normal blood pressure, we know that there's going to be an issue. Could be cardiovascular, could be a stroke. So, we want to make sure that you up that nitric oxide, increase your the plant-based diets and all the colorful rainbow foods. So hopefully that helps you have more reason to eat those wonderful, colorful plants, vegetables. There's great ideas. So anyway, that's all I have for you tonight. I hope you find this information very helpful. Please share and pass it on. If you're interested in having any questions, please shoot me an email, or you can even text me. Give me some ideas of what you like, or if you want, always consult your doctor before you make any changes, discuss it. I'm happy to work with your physician as a subspecialist in inflammology or wellness or optimization of your health. And because I'll just be your MD coach to give you the tools that what you need. So you can reach me at my website at anitawangmd.com or call 949-734-0580. And you can schedule a complimentary discovery call, and we can chat and discuss what your issues are. Till next time, be safe and be well.